right. Hello, everyone. Good afternoon. Welcome to Ask the Docs, a Fertility Institute of Hawaii live stream. So this month, our topic is integrating Eastern and Western medicine into your fertility journey. Thanks for being with us today. We have a lot of great info. My name is Dr. Carmona. I'm here with Dr. Fraterelli.
Aloha.
Yeah, so I think that we thought of doing this live stream today because a lot of our patients are really interested in integrating alternative medicine and Eastern medicine into their fertility journey. And although we certainly are not experts on Eastern medicine, I think we thought that we'd share some of our viewpoints and some of the literature that's available about it. And so definitely feel free to ask some questions throughout. So I think we can start out by just talking a little bit about some of the differences between Eastern and Western medicine. And certainly I'm not an expert on Eastern medicine, but one of the major concepts with Eastern medicine is kind of the restoration of balance of body function and the concept of preventative medicine. And it takes a more holistic view of sort of looking at patient symptoms and then sort of trying to understand what may be off balance, whether that's in that particular system or whether there are other systems that may be impacting it. So certainly more holistic, very, very different than Western medicine, which mainly focuses on physical proof of illness and kind of the diagnosis of one particular issue and treating that issue within the system that it's impacting. Both Western and Eastern medicine will use various therapies like medication or things like acupuncture or physical therapy, for example. So there really isn't any kind of rule about what type of treatment specifically is used for Eastern or Western medicine. But I think that the structure of Western medicine and is very, very different in terms of how we think about the treatment. Western medicine is very heavily focused on evidence-based practice, very focused on researching particular systems and particular treatments. Whereas again, Eastern medicine is sort of looking at a more holistic approach and certain types of therapies which are much more difficult to study and evaluate within the kind of Western mindset.
Yeah, so I agree. If you look at the two, Eastern medicine is again looking at more of a holistic view, and there's the 8 principles that they look at: the yin and yang, the interior versus exterior, hot versus cold. And what was the other one? External and internal. I'd say that one, or excess and deficient is the other thing. And we look at those as well. I mean, look at if the hormone is deficient or excess, but we don't. The hot and cold thing we don't really assess, and I do see that in notes that I'm getting from patients or from other providers that patients are seeing sometimes. And so it definitely makes me understand a little bit more, but it's been around for so long. And I guess the issue that sometimes we may have with it is that we don't have the science behind it. We don't see that it's the particular treatment is working compared to a placebo, for instance. And certainly some of the treatments may work, and they do work. But that's one of the things that we always are looking for. Is it compared to placebo doing nothing, or a sugar pill? Is it better? And the reality is we've had lots of treatments in medicine, that we thought were great, and then we did a placebo trial and they weren't very good. But certainly a lot of our patients are taking herbal supplements and Chinese medicines, and we're all for it. We always, when I get them, I always do a Google search, and I really kind of research and try to figure out is it something that might be harmful to an early pregnancy, or might prevent an implantation, or is there something that might, what I'm treating the patient for fertility purposes, is it going to interfere with that? And if it's not going to interfere with it, and I can clearly show that there's no evidence that it would, then I have no problems with patients continuing it.
So Chinese medicine and a lot of kind of alternative medicine therapies utilize herbal supplements. And one of the major issues with herbal supplements is the oversight of supplements is very, very different than the oversight of medications, which can be obtained via prescription. And so, unfortunately, it's harder to know if what is actually in that medication is what's listed on the bottle, and that's true for all supplements and vitamins, not just Chinese medicine, but just the supplement market in general is not as closely regulated as kind of the prescription medications that you can obtain. And so I definitely urge caution in using those kinds of supplements. There is a lot of intersection between kind of what we recommend for supplements and what some alternative providers will recommend as well. So, for example, for egg quality, coenzyme Q10, which is technically, which is a supplement, it's not a prescription medication, has been pretty well studied, and it shows some benefit. Things like vitamin D, things like folic acid. I mean, these are all things that are very well accepted to have very real effects in Western medicine, but are also considered to be supplements. I see here somebody's writing in that Dr. John is the best. Thank you so much.
Oh, I was typing that in.
Dr. John was typing that in himself. Yeah. All right.
Yeah, but along that line, not about me being best, but about what you were saying. When patients are on herbal supplements, there was a study a couple of years ago that looked at herbal supplements that patients would take and found that all of them have other things in them, and some of the things that they may have are like estrogen component or progesterone component. And if you're taking a progesterone component in excess during a treatment cycle, for instance, when we're going to do a transfer, and you're getting that progesterone before you should be getting it, that certainly can affect the implantation rate for patients. And so for that reason, we are very careful, very cautious, and usually we do err on the side of caution. Say if you don't need it, try not to take it at this point. It may not hurt it may not be harmful to a baby, but it might be harmful to the lining of the uterus for the next couple of weeks. So if you can lay off of it. And patients are usually pretty good with that.
I also wanted to bring up that there was a study, or there was kind of an editorial rather, regarding men's workout supplements that are made for men. And they did find that there were a lot of kind of unlisted testosterone derivatives in some of those. So even the over-the-counter workout supplements, which you might think are completely benign, those can contain very active hormones, which for men can harm sperm, and if women take testosterone, that can also have impacts on implantation and the lining of the uterus as well. So we definitely urge caution. It's something that you should kind of bring up to us or your provider when you're doing treatment, so we can take a look at that for you.
We oftentimes will give women estrogen or progesterone, and I think just kind of the female hormones. And I think that one of the things that people consider is obviously testosterone being a male hormone, that okay, men take that should help sperm, should help fertility, but the reality is it kind of does the exact opposite. It really shuts the testicles down and causes the spermatogenesis to stop, and so you get less sperm production. And ultimately, if you're taking enough of it for long enough, you get no sperm production, and then the amount that it will come back or rebound after you stop taking the testosterone definitely varies for men. So certainly be careful with that.
So one of the treatments that people always ask about is acupuncture. And acupuncture is one of the things that has been pretty well studied in fertility, especially around the time of embryo transfer. And the data, I mean, there have been kind of some conflicting studies, some studies showing that acupuncture has been beneficial, some that haven't. And there are some studies which kind of compared sham acupuncture to regular acupuncture. Sham acupuncture being kind of needle points in the wrong areas, the areas that are not the typical areas that you're supposed to be pinpointing. And when those studies were done, typically there was no difference between regular acupuncture and sham acupuncture. But there are some studies which did show benefit. I don't know if Dr. Fratarelli, you wanted to go over one, which I know you were involved in.
I was. I think when you look at the literature as a whole, you find that acupuncture may or may not be beneficial, but it's certainly not detrimental. And so I take a passive approach to it and tell patients, it's not detrimental if you want to take it. If you want to use it, certainly do. I was involved in, I believe it's still the largest trial, certainly the largest randomized controlled trial with acupuncture that's ever been published. There's 1,000 patients. It was 5 groups, randomized into five different treatments. So one was nothing. We just told patients that you don't get anything, which obviously has a psychological effect, right? Which is what we wanted. And then another group, we said, okay, well, you know what? We're just going to listen to music and relax, and we give you this relaxation time. The other group got acupuncture, just traditional acupuncture, the way they normally would be, and it was done right before the transfer and right after the transfer. And then another group got laser acupuncture, which was when you use a laser and you fire the laser at the acupoints, and that stimulates the acupoints in the same way that acupuncture does. The last group got a sham laser, and the sham laser was really important because it's really hard to do a sham needle, right? You can't pretend to stick somebody with a needle and not do it. They know that it's not done. But with the laser acupuncture, the patient sees the laser, they see the red dot, they hear everything, it's all the same. And you don't feel it whether you're doing the laser acupuncture or you're getting the sham. So there's no sensation at all either way. So that was really a perfect sham way to do it. And what we found was that actually the laser acupuncture had the highest implantation rates, followed by regular acupuncture, followed by the sham, and then relaxation, and then people saying, we just said, sorry, you don't get it. And so, but the laser acupuncture did have about a 3% higher implantation rate than the regular acupuncture, and then regular acupuncture had about a 3% higher implantation rate than the others. So there was some validity to it that we did find.
Yeah, and so I kind of tell my patients that, if this is something that they want to do, it's not going to hurt, and they should.
Have you had acupuncture? It doesn't hurt.
You know what? I did have acupuncture, and it didn't hurt. But it also didn't help. There was a nurse, I had a really bad headache, and she was, this was in my training, and so she stuck a bunch of the acupuncture needles, and then it didn't do anything, and my head still really hurt. But then when she asked me if my headache was better, I felt really bad, and I said, yes, it's much, much better, and can you please take the needles out of me? So that was the one time that I did have acupuncture, and it didn't help me. But so I tell my patients that they can try it, and if it works for them. But if it's something that they don't enjoy and they don't want to do, and it can be costly too, then I think it's something that they can definitely drop from their treatment. You guys on your fertility journey know that there are so many things that you guys need to be doing, coming in for appointments, just and blood work and all kinds of various appointments and other things that take up a lot of your emotional time. And so if you don't enjoy acupuncture, I would say you don't need to do it. But if you do, go for it. That's kind of how I present it to my patients.
Same for me.
Yeah. What else? What else can we talk about? I think one thing that you kind of mentioned a little bit is the timing of things, so the timing of when it's okay to take supplements, when it's not. I think when patients are actively taking medications, injectables, and things like that, sometimes I say, we don't know how these kinds of medications will interact, perhaps hold off. And certainly in the very early part of pregnancy as well. We don't quite know how these things are going to impact the uterus, blood flow to the uterus, implantation, and all that. So those are really some of the times to be very, very careful, as opposed to perhaps preparing for an IVF cycle before you're actually on medications and things. Then that's probably sort of a safer time to consider using medication. Acupuncture is fine during treatment, and certainly around the time of transfer, that's okay.
I'd like to point out that Eastern versus Western medicine, we're not as much different as a lot of people think. I mean, especially in the fertility. I mean, we're treating patients with hormones that they're already that are natural, that they have in their body. So, for instance, for a fertility patient who isn't ovulating well, or is doing IVF, we give FSH, follicle stimulating hormone, which is the same hormone that the brain makes. We're just giving excess, and so we're giving something that's natural in essence. A lot of times, what you'll do otherwise is you give a medication that tricks the body into doing something else, or you're getting around it in a different way rather than just giving exactly what the body needs and replacing that hormone. So I think that a lot of things that we do are essentially very natural, even though there are a lot of we kind of go a little bit further when we're doing IVF, for instance, and taking eggs and sperm and making embryos in the lab.
Yeah, and there are a lot of different approaches too that we can. I mean, this is a little bit off topic, but there's certainly the option for patients who are just kind of starting on their journey of doing natural cycles. There's the option to utilize pretty low doses of medication. There's the option to do mini IVF cycles. So there's kind of all different ways of, there's the InvoCell, which is an intravaginal incubator, so that the embryos kind of stay in your body for a while, technically. So there's sort of all kinds of ways to take a more minimal and natural approach if that's something that's really important to you.
I think that the thing you have to look at, though, during the evaluation phase is, if someone's not ovulating, for instance, because of stress and because of other things, then certainly, Eastern or Western medicine might be beneficial with that. But if someone has a critically low sperm count, or the tubes are blocked, there's really nothing.
Yeah.
Medication really typically isn't going to fix it. Sperm may be but very minimal effect, but typically medications aren't going to help those things. You need procedures. So you have to know what the cause of the fertility is, and that's certainly what we would do in an initial evaluation for anyone.
Yeah, I agree. All right.
Let's see if we have any other questions. I think I would point out too, I think we mentioned this a little bit earlier, but we do get questions from patients all the time about herbal supplements they're taking, and again, I just look it up, and I Google it. I think Google is, I always tell you always hate to Google tell patients to use Google as their source, but I think that if you know where to look, and you look very critically, Google is very well. You can look and find the answers that you need. But we do that, and we do research and figure out is it safe for somebody to take? And the answer is a lot of times we just don't know. And I always hate telling patients I don't know. It makes me sound stupid, but the reality is I don't know because there's no evidence.
Was there a question? I don't see any on here.
Here
we go. What is your experience with acupuncture and IVF, regulating the menstrual cycle, preparing the endometrium? Yeah, so I think that the majority of the data that we have regarding acupuncture is around the time of transfer, which we were really just discussing. That's what a lot of the studies are focused on. I think that, certainly there could be other benefits, especially what Dr. Fraterelli was just saying in terms of lowering stress levels, and that is going to help you ovulate and potentially help regulate the menstrual cycle, help with endometrial receptivity and all that as well. But the majority of the data really are focused on peri-implantation.
Yeah, and I think that's important. The menstrual cycle and ovulating and the endometrium, they all go hand in hand, right? And so, if someone's not ovulating, then they're not going to menstruate regularly. Their lining's not going to be appropriate. But you get somebody to ovulate, and then they're going to menstruate appropriately, and the lining is going to be good. So it really is the key.
Yeah. All right. Perfect. Well, thanks for joining us. And of course, you can always let us know if you have questions after the fact, or if you're working with us, an IVF coordinator, let us know. Definitely, if you're our patients and you're on supplements and have questions about that, certainly please do let us know so we can look into those things for you. Yeah.
Yes. Aloha, everybody.
Aloha. Bye, guys.
Bye.